it was always viewed as a one and done disease. So you get your plasma, you get your steroids, you go home, and you're probably not coming back. Well, the reality is it's not. There's at least half of patients who relapse, which can be significant. But the bigger issue is that, and you may have heard this from Shruti, that people aren't right in remission necessarily. Some are, but there are probably at least a half, maybe 2/3 of patients who have some chronic sequelae. Neurocognitive deficits are common, sort of a short-term memory defects that they get. It's very problematic for patients. If you don't know the patient, you're talking to them, they seem just right, but there's a little bit of word hesitation, forget where they just put their keys, their spouse asks them the same question 3 times, or maybe rather I should say they ask their spouse the same question 3 times and they've just forgotten that answer. So it's some new memories, new learning that can be problematic. But headaches are an issue, some mood disorders, depression, some behavioral changes that you can see. And then long term, there's at least several studies that show decreased life expectancy, and not necessarily from TTP relapse, but it's from long-term complications, chronic vascular, cardiac, and neurologic issues. But the mind frame has to change that this is a chronic disease. It seems logical if the person who has 5 episodes is going to have more trouble than the person with 1, but that's not the case. You can have just 1 episode and have some of these same long-term issues and be very problematic. And again, we don't know how common they are. There's certainly a spectrum, but I would guess at least half are affected in some way.